in and get simple and affordable medical benefits so you can build a better team. Call 440-4447 or log on to beacon.co.tt for more information.
2 times 2 is 4. 2 times 3 is 6.
Education multiplies their chances and places the world of opportunity in their hands. No matter where they are in the world, make sure they're prepared for their journey back to school with Western Union. School fees, books, room and board, whatever the reason. Knowledge, independence, opportunity. Western Union, moving money for better.
And we are back inside the room for another ladies' room for today, Tuesday, June 1st, as we start off another new month. Yeah, seems as though we started January just a couple weeks ago, right? And here we are already in the month of June, and of course, official start of the hurricane season. So we got a lot to share with you as always. So just want to say special morning to all your loyal listeners and viewers, and those of you tuning in for the first time. It is an absolute pleasure having you here. And of course, as we get into today's conversation, as always, you can chime in questions or need clarity on certain things. You can hit us up in the chat box, and we'll be more than happy to ask our guests. All right. So with that said and done, I think we can jump into the live and let you know we are definitely on Facebook Live. So hit the share button when you get there. Good morning, Christelle. Good to have you already. And everybody else that's coming into the room to be part of today's conversation. Alrighty. So let me introduce my guest. As a matter of fact, I'm going to let her introduce herself because I'm not about to mess up that surname. I'm going to let her introduce herself so we'll get a proper pronunciation of her surname, and then we'll take it from there. Good morning, and how are you?
Good morning. Thank you. I'm very well. Yes, my name is Karin Schiøler. This is a Danish surname, so it's next to impossible to pronounce. So yeah.
I was like, I'm not taking that chance this morning. Let me make sure you get it out first, and then we'll take it from there. So Karin is fine. So how are you? How have you been?
I'm doing quite well, thank you. I'm currently living in Copenhagen, and I think we're beginning to see the end of the lockdown that we've been going through here. So and summer has arrived, so it's not Grenada temperatures, but at least it's hitting 20 degrees, so that's very nice. So,
what sort of effect has COVID had on Denmark? What is it like?
Well, we went into lockdown last year, 12th of March, and that lasted until summer when there was somewhat an ease of this, and then the second wave hit. So we went back into lockdown, I think in November, end of November, December, and we're just now kind of climbing out of it again. So we've seen cases, we've seen deaths here in Denmark.
How badly are you affected in terms of numbers?
Well, we were seeing, I think, compared to a lot of other countries, and especially Sweden, that we normally compare ourselves to, we've been fairly lucky, or some would say because of our cautious, we've been doing well, but we have seen, I think, at some point daily death at 35 or thereabouts. So, and we're a population of nearly 7 million people. So it has had an effect, and of course, we're an older population compared to Grenada, at least. So we have a lot of people in the high risk group, so to speak. So yeah. Wow. But right now, I think we're seeing very few deaths, and as I said, things are looking bright. Not just the summer, but also perhaps life coming back to normal.
What do you think? What do you think contributed to not many deaths anymore? Protocols, vaccines. What would you say was responsible?
Well, we've started the vaccine much later than Grenada, by the way. So it started picking up in March, and we've been vaccinating according to age and risk group. So I think that has had a profound effect since we started vaccinating. but of course also all the precautions all the precautions measures that we have seen, that we're all wearing face masks when we go into shops and buildings, public buildings, and so on. And our children, everyone's learned to wash hands now and be careful in terms of how you sneeze and all these precautionary measures that you can take. But I think the game changer here is definitely that we're now seeing the vaccine being rolled out. So
fantastic. Yeah. We'll get a little bit into that, a little more into that later. But I want to talk a little bit more about your connection with Grenada. So probably could just tell us a little bit about yourself and your connection to us at home.
Yeah, well, my mother, Elsa Wells, is Grenada, is Grenadian. Her family is from up St. Andrews, La Ligue, so to speak. But I grew up in Denmark, and that's where I'm currently living also. But as a child, I used to come to Grenada whenever, ever so often when we could afford to. It's an expensive journey back then. And this is back in the times when we'd land up in Pearl's airport. So I suppose that kind of suggests how old I am, yeah. But I actually came back and I lived in Grenada for about 5 or 6 years after I finished my master's degree here in Denmark. And to be honest, it was kind of by chance. It was because my attention was caught by this strange disease that back then called dengue. And I thought it would be quite fascinating to do research on dengue. And, thankfully, St. George's University and WINDREF, supported that idea. So I went to Grenada to do a PhD project and to do research on dengue in Grenada. So,
what were some of your findings as a result of that of that research?
Well, I think what I actually did, I set up a dengue diagnostic surveillance system. So I was able to laboratory confirm dengue cases, and with the help of people from the Ministry of Health, like back then, surveillance nurse Banfield and Dr. Entwine, who was chief medical officer, I actually managed to get the doctors and nurses, that all the health clinics and the GP offices and the hospitals to actually send samples that I could then test when they had a suspected case of dengue. So because of that research, I was able to kind of document how an infectious disease that causes these acute epidemics, much like COVID-19, actually, how can you say, transmits through a small insular population like Grenada. How rapid it goes from the time you see the first cases to it starts building up. So yeah, that was kind of some of the findings I had with that.
That too we'll go a little bit deeper into, but in terms of out of everything in the world, there's so many things one can choose to do or to be. What led you down that path to becoming an infectious disease researcher?
Well, actually, I started out doing something completely different for my master's thesis. I was working with chronic diseases, multiple myeloma, which is a bone marrow cancer. But I think it was, as I said, by chance. I was by chance living in Martinique during my sabbatical, and I came across a public health outreach from the local vector control unit, where they put up their microscopes, and they were showing the culprit of all this, the mosquito Aedes aegypti, and I got, I started chatting with these people, and they were explaining, that they were trying this outreach to make people aware that they had a potential threat right there in their houses and in their backyards and so on. And from there, I just got more and more curious. I couldn't understand quite how a mosquito-borne disease, an infectious disease like that, could cause so much havoc in a well-developed region as the Caribbean. So the more I read, the more curious I got, and one thing took the next. So, yeah. Pure chance.
And that's an amazing chance, though, because it has led you to other avenues that open for you, which is one of which being an associate professor in the
Yeah.
global health section at the University of Copenhagen. Speak to us on that.
Well, yes. When I returned from Grenada, I was looking for people who were interested in dengue because this was my passion, and I came across what was then the international health section, which is now the global health section, and thankfully they were interested in my profile as well and the kind of experiences that I had from Grenada. So what I do now, I lecture. I'm a lecturer in global health. I supervise mostly master and PhD students, and then I do research, of course, also.
Alrighty. Now, let's get back to come back home, Grenada. This is, of course, your home as well. Take us back to when you were researching, you were undertaking your research on dengue in Grenada, while also earning your degree from and PhD from SGU. What was interesting about those findings?
I think for me personally, the major thing I got from that experience was, I was a lab rat when I arrived in Grenada. I was used to work, doing PCR analysis and these kind of things. And the study I undertook there actually forced me out of the lab and to, meet with the health system, meet with the frontline healthcare workers, the nurses, the doctors, and had them engage with my project and the notion that, well, there's a problem here we might be able to address through improved surveillance and so on. So, I think for me that was a major eye opener, and I was even invited to be on the dengue task force during a dengue epidemic at the Ministry of Health. So, imagine that.
One thing led to another.
Mm.
So interestingly, what would you say is the relation between your research on dengue? How does it apply to the current healthcare situation surrounding COVID-19?
Um, I think there's a lot of similarities in the sense that we're dealing with an infectious disease, both in terms of dengue and COVID-19, that causes these rapid acute epidemics. And it's when I did my research, I was able to kind of track the origin of the virus, its likely time of entry into the island, and so on, through surveillance. And one of the things I saw, for example, was there was a neat correlation between carnival season, the influx of a lot of people to Grenada, and then a few weeks later, the epidemic sort of taking pace. So this whole notion of how we move between geographical areas and we carry things with us and we bring it to other places, is definitely something that resonates for both diseases, I think.
It's interesting that you said that because in previous years, well, at the exception of last year when we didn't have a carnival, but previously, every time the carnival season is over, there's always some flu of the
There's
sort.
always the flu,
Always
exactly.
flu of some sort, and we give them all sort of crazy names, based on what's trending at the moment. But there's always something going around after we have so many coming in and leaving and intermingling and what have you. And I always wondered, well, why and how, but now it makes a lot of sense.
It makes a lot of sense. Even, with COVID, it's even more, you can say, acute because it's an airborne disease that, that spreads when we're close to each other. Dengue requires this mosquito vector, this intermediary that carries my virus to you. So we don't even need to be in the same room. In fact, just the mosquito has encountered both of us. So there is this similar, but basically, if the conditions are there, and mass aggregation, people being together, it's unfortunately the perfect cocktail for these diseases, because at the same time it's fun. I mean, we're in Grenada, we like to hang out, we like to lime and all this. So, but there are a few precautions we probably need to take. Lessons learned.
And that's a good question to ask you. What sort of precautions do you recommend in the case of dengue? Because I mean, it's something we hear of a lot of the times, and as a matter of fact, it's still prevalent now because I know of someone, family member, who actually had it a couple of weeks ago.
Yeah.
So, what are some of the precautionary measures or what one can do?
I mean, dengue is a troublemaker, and I think it goes not just for dengue, but the key problem, as I see it, is this mosquito, this Aedes aegypti mosquito that has adapted so well to how we, live, to our household, to our, environment. And mind you, it's not just dengue that it can transmit. It can
Mhm.
transmit yellow fever, chikungunya, Zika,
It's
you name it.
one little thing you could barely see.
And there's a line of viruses out there waiting to jump on. There's a queue.
The blame the
So
mosquito. Mhm.
to me, I think getting rid of that, targeting that mosquito is really important, and that's also some of the research I'm currently engaged in, is to try and figure out, well, how do we actually manage to target it, to get rid of it, to clear it from our environment, basically, from our daily life. So yeah.
Because it's been around forever, and right now our Ministry of Health, they're engaged in fogging different areas where it's more prevalent,
Mm.
fogging operations where it's more prevalent, but they disappear for a couple and then they come right back.
Yeah, and then that's the problem too. I think there's no, at least currently, there's no silver bullet. We need to do a lot of different interventions. We need to make sure that we don't harbor mosquitoes in our backyards and in our households and so on. We need to perhaps be better at screening our houses. And I know these are not easy to do things, and I mean, hopefully, eventually, there will be, a universally safe vaccine for dengue. But right now, I think it's going to take a while still. I mean, there is one on the market, but it can only be used in a sort of very narrow area, so to speak. So
This might sound like a crazy question, but are mosquitoes attracted to heat?
yeah, yes, they are. They're attracted to the carbon dioxide that we exhale, to the various odors, the plumes that come off our skin and our bodies, and they use those to kind of hone in on us when they first sense, and they move around looking for their blood meal, and then as they come closer, the heat sensory system kicks in, and they'll go for the warm person, so to speak. So
So
yeah,
how do they
not
know
a crazy
where my
question whatsoever.
how do they know where my air is? Because it seems as though they always seem to find your air no matter what you do.
Exactly, yeah. I think it's the nastiest creature I ever came across. Definitely, yeah.
And the most troublesome, because I mean there are so many different viruses associated with mosquitoes. The
Yeah.
list is pretty long. For
Mm.
that little insect that you can barely see, but the research had to continue. And in terms of the times we're living in now, of course, with COVID-19, and earlier on you mentioned about the vaccination kicking in Denmark, and that seemed to be helping with the virus. Have you been vaccinated?
Yes, I got my first of two shots last Wednesday, so I'm on the scheme now. Months after my Grenadian friends, but I'm finally
Why
reaching.
did,
So
why did you decide to get vaccinated?
well, I think there are several reasons.
What you
There's the personal reason. I think COVID-19 has to be taken seriously. I know a lot of people, it's a mild flu, maybe they lose their taste or smell, sense of taste or smell for a while, but actually it is a deadly disease, and I think also I'm particularly worried about this whole long COVID situation. So people who have symptoms, various symptoms lasting for months after infection, I think, I mean, personally, I would not want to experience that. But then, of course, secondly, the whole issue of, I mean, it's not just me that needs to be protected, it's the community I live in, it's my family, it's the vulnerable people who, for various reasons, can't be vaccinated. So it's also out of duty. I mean, you have to, of course, think on behalf of others. So yeah, that's my reasons. And I think lastly, I have a yellow fever vaccine because, in order not to carry the vaccine when I travel, so that I don't bring a new, or bring yellow fever into an area where it's a novel disease. And it's going to be the same with COVID. I mean, I would hate to be the one who brings in the next aggressive strain of COVID when I go visit Grenada in December, hopefully. So yeah. So
Because
various reasons.
in the news, if you look at the news every time you think, okay, yeah, we got this one under control, then you're hearing, okay, there's another strain that is just showing its head in so and so
Yeah.
place.
Yeah, and I think that's why it's so important that we hurry to cover as many people as possible, because you could say, in a way, the strains that are circulating now, I mean, what you're seeing out of India, out of Brazil, and so on. I mean, at some point, it won't just be a lockdown and staying isolated, because they spread very rapidly. Perhaps it's a new age group that it's going to affect, not just I see, but imagine if we see the same symptoms in children as we're seeing in the elderly and so on. I mean, it's yeah. We really need to get hold of this as soon as possible. Yeah.
What parallels can you draw between the dengue vaccine and what's taking place with the COVID-19 vaccine?
Well, in terms of the dengue vaccine, as I said, there's one on the market, but it's not very efficient, and can only be used for sort of limited populations. And that has taken 50, 60 years to develop, to reach this stage. And now with COVID-19, in 1 year, we've managed, the pharmaceutical companies, the research community have managed to come up with not just one but several vaccine candidates, and I think that's quite amazing. That's really an achievement, and I hope to some extent that we'll see some of that transferred to some of the other diseases. Not just the one that affects on a global level, but diseases that have more of a regional or pose more of a regional problem, because we never know when that regional problem is going to expand into a global issue. So we're kind of all in this together, I think. So that's my main sort of take on the parallel between those two vaccines, and the likelihood that hopefully we can get some highly efficient vaccines for dengue and some of the other viruses soon. Yeah.
It's funny you were saying that it's amazing that in less than a year we were able to have so many different vaccines. On the other hand, this seems to be an issue that persons have. I don't know, not an issue, but a reason for not taking the vaccine, because they're saying it was too quick. They don't think that it was ready. There was enough time, sufficient time was done. No, investigations, enough research was done to create these vaccines that they're seeing. So that seems to be one of the issues persons have, and using that as a reason why they're not going to take it, because the length of time it took.
Yeah.
What would you say to that, though?
I think the situation is unusual in the fact that we have, you can say in a way it's the perfect petri dish for testing new vaccines, because we have an ongoing virus that is spreading globally. So we really have the opportunity to test it on a lot of people while the virus is there. Whereas take the dengue vaccine, for example. One of the reasons why it's taking so long to develop is that you have to test it. It's been tested in certain areas, and then you have to wait for dengue actually to show up, and then 2 or 3 years pass, and so I think it's been a unique situation. And of course, also there's been a political will and a financial will to see this happen, so that we can test massively and so on, and speed up some of these processes that sometimes take a lot longer in terms of actually reading through all the data that's collected for a vaccine trial and so on. I mean, things have been sped up to achieve this. So yeah.
Because it's not a case of okay, here you have a dengue outbreak in South Africa, that's it, or you have a dengue outbreak somewhere, and that's it. This is a case of is there any nation that has been spared? Any part of the globe that has been spared?
I'm not sure. Greenland, perhaps. I'll have to check. Yeah.
I think I need to do some research and find out if there's any place in the world that has been spared the wrath of COVID-19. But in terms of understanding, because there's so many, when you speak to people, there are so many different takeaways as to why they should or why they shouldn't take the vaccine. So how can people's risk understanding and risk perceptions and, just general human behavior combat COVID-19?
Well, I think the issue about, like I was saying, well, I do it for personal reasons, then I think of my family, then I move it, the community and so on. I think perhaps stepping outside of your own, person and thinking a little bit ahead of how may this affect beyond me, if I'm not vaccinated and I transmit to the next person, and eventually how would that affect, the healthcare system if we have uncontrolled transmission, as we've seen in so many countries now. It's not just the deaths from COVID that is the problem. It's the deaths because of all the other diseases or accidents or what have you that can't be treated because the health system is not functioning because of the burden. So it's perhaps thinking a little bit beyond just your own comfort zone in terms of being vaccinated or not.
And I think in terms of Grenada, we were fortunate not to have the amount of deaths or the amount of cases that we're seeing popping up around us. We were fortunate to manage it. As of now, 0 positive cases, and it's been that way for quite a while. And I think that's one of the factors influencing people's hesitancy in that, okay, well, I'm not seeing deaths. Like I have no family member or a mother or father or sister or anybody close to me for that matter, died as a result, or you're hearing of friends or coworkers of that sort. So it's sort of like, okay, I think we're safe. Good.
And there's a word for that, and that's complacency, because in a way you had the same situation in India. It's not that long ago that, the government of India said, well, we have next to no COVID problem here. We're over it. It's the problem elsewhere. We can open up, we can, party, and bam, it hits. And now they're simply not ready. So I think complacency is a dangerous bedfellow, also for places like Grenada. And I absolutely agree. You've done amazing in keeping the numbers down, and so, but it's also come at a cost. It has come at the cost that everything's been locked down. The tourism industry is hit by this as well, so it can't continue that way. There has to be some checks in place.
Because Canada is also on lockdown for a while, and the numbers still continue to go up. This morning I was listening to some news, and the United Kingdom, they're talking about a third wave.
Yeah.
And further lockdowns.
Yeah. And with those waves, every time there's a risk that the strain that's being transmitted, that's causing the wave, is a little bit more aggressive than the last one. So yeah, that has died. Having said that, I also think we are seeing quite significant effects of vaccinations, like in the States and so on. I mean, there's some really impressive drops now in transmission. So yeah.
So someone who is hesitant about the COVID-19 vaccine, what would you say to that person?
Well, my mum was hesitant. She got her vaccine back, and she's got her 2 doses. She's through. Her last dose was back in March, and after her first dose, somebody after the first day, somebody on Facebook sent her this video or message about a person her age who had the vaccine, and he dropped dead at this very same moment. And of course, that creates a lot of worry. And so, and I had to tell her, well, that, look at the data, but that's so easy for me to say, because if she's a lay person, she wouldn't be able to say, well, it's the likelihood is so little out of so many people and so on. But I think what I would say, though, is that I think as researchers, as policymakers and people who work with this, we can't dismiss people's fear or their hesitancy. I think we have to, allow for that, but also to inform as best as we can. And at least my advice would be, look into. There's lots of trustworthy information out there. Check your sources. Go to reliable sources like Ministry of Health, WHO, PAHO, CDC, so on. Check what they're saying, and it's not. And be perhaps a little bit more skeptical about stories that are bouncing out around on Facebook and on the internet, where sometimes the sources of these stories may be somewhat fuzzy, to be diplomatic about it. Yeah.
And now, with information being so easy to be disseminated, you just check your phone. It's like, okay, I don't even know this person. I didn't even give permission to be in this group, but then you see a whole lot of messages constantly coming at you, bombarding you with information. I mean, like I say to folks all the time, it's all about the pros and the cons. Don't just tell me why I shouldn't, but let's look at both sides of it and then make an informed decision. It is not something that's being forced down anybody's throat, as far as I can understand. As far as I know, it is not mandatory. It's your choice to take it or not to take it. There's nothing in law that says you have to. But my whole thing is just having, just using discernment. Have both sides of it. And there are a lot of people who do this daily. The entire day just be sending you these messages, and you have to block left, right, and center. I'm good.
Yeah, I'd even add the advice of talk to people who was vaccinated, like my mom. After her second dose, she's perfectly fine, and she enjoys the freedom she has now that she can have friends and family come over. She can move freely without being afraid. We can hug her again, things like that. Talk to those who've been through it, and get their view as well. Yeah.
Alrighty, well, we're almost there, but why is it important for residents and visitors to follow public health guidance and regulations to minimize the spread of the virus?
Well, I think that goes back to what we talked about already, in the sense that Grenada, although there's a lot of very diligent nurses and doctors, and but the health system is nonetheless fragile. And even if it weren't, we've seen robust health systems collapse during this outbreak. So I think the fact that if we don't follow the guidance, the worst case scenario is the breakdown of the healthcare system in Grenada, and that would be absolutely horrible. If cancer patients couldn't get their treatment, pregnant women and so on couldn't give birth in the hospital because there's no place to go. I mean, in fact, that's kind of the scenario we've seen, many places with COVID-19, but it's not that unfamiliar for dengue also. I mean, we've seen, just the colossal overburdening of the healthcare system, and the effect it has, the trickle-down effect it has on so many other diseases. So yeah, I of course you should follow the guidance and try not to feed this monster. Yeah.
I remember when we had an outbreak of what's it called? Is it chikungunya?
Chikungunya, yes.
That's when we had an outbreak, and everybody was in pain, and the health system already, it's like you said, it's already overburdened. So imagine having an outbreak of COVID-19. It's already fragile. So imagine that.
Yeah.
So. Anyways, I think that's all the time we have. Thank you so much. It was an absolute pleasure speaking with you this morning.
Thank you, and likewise. And I do miss Grenada. I was supposed to go back in December, but COVID happened. So
you'll be here soon.
A year later, yeah.
You'll be here soon to get some sunlight, like warmth. All right. So thanks so much. It was an absolute pleasure having you in the room this morning.
Bye. Thank you.
Have a good one and be safe.
You too.
Thank you so much. And that just about concludes our conversation this morning. Hope you guys were following along. Yeah. I'm going to see what I have to say for tomorrow. this was too good a conversation to tell you guys anything else. All right, so we'll be back tomorrow to continue with your ladies' room right here on Power 95, and of course, came to you through the kind compliments of our friends at Beacon Insurance and Western Union. Catch us again tomorrow, same time, same place for another one. Alrighty, done.